Hi, everybody. This is Congressman Mike Levin. Thank you, as always, for joining us for another great event, another virtual town hall. And we have such a wonderful guest once again, Dr. Richard Garfin. He's visited with us so many times throughout the course of this pandemic. He's probably been our most frequent guest throughout the duration of COVID-19. And if you go back into the archives and you see our conversations over the past year plus, you will be able to kind of see the arc of COVID-19, the various ups and downs. But just so pleased to see him. Dr. Garfin is a distinguished professor and epidemiologist from the Department of Medicine and the Global Public Health Division at UC San Diego, and of course was a longtime leader in the CDC in Atlanta, and just a wonderful leader in our community. So Dr. Garfin, thanks again. It's great to see you.
Yeah, it's really great to be back, Mike. And since probably the last time I was on, we have started a new School of Public Health at UCSD, the Herbert Wertheim School of Public Health. And so I have an appointment in the School of Public Health now, as well as medicine. So just add that on to my title.
Fantastic. Well, I am so grateful to you for all that you've done in San Diego and really beyond San Diego over the course of the last year plus. Just your leadership has been tremendous, and we're just so grateful to you and everybody at UCSD for all your hard work. And I think that there is a light at the end of the tunnel now. Of course, things are getting better in California and throughout the United States for the most part. It's been a horrible year, as we all know. Over 572,000 Americans have tragically lost their lives due to COVID-19. And it's easy to get lost in the numbers and the statistics, but these are human beings. These are our friends or family, lost loved ones, coworkers, colleagues, and it's just devastating for our nation and for the world. And of course, we see around the world now, particularly in places like India and Brazil and elsewhere, real spikes. And I know we're going to be talking about some of that. The good news, California, of course, we have had over 3.7 million cases. We've had over 61,000 deaths, but things are getting much better. And our case rate is among the lowest anywhere. And our death count is dramatically lower than it was. All a great testament, I think, to those of us in California who have stuck with public health experts, stuck with the epidemiologists and the guidelines out there for the last several months, none of which has been easy, but nonetheless has, I think, led to a dramatic decline in the case rate, the hospitalization, and ultimately the deaths from COVID in California. And I would just encourage everybody, as we're getting through what I hope and believe to be the last few months of this, where we're getting the vaccinations out there, where things really are getting back to normal in a meaningful way. Let's just do all we can to keep each other safe and healthy in this last leg of this race. And that's what I would ask of our viewers and our listeners. So keep following the CDC guidance. Earlier today, there was some great news around masks, where if you have been fully vaccinated and you're outdoors and it's not a crowded activity, the CDC, now has said as of today that you actually do not need a mask anymore in those circumstances. So that's great news. It's yet another reason to get vaccinated, among many others. And I hope that everybody will do that soon. I can tell you, I've visited a number of our vaccination sites throughout the district, and I'm so incredibly proud of the work that's being done by our counties, by our hospitals, by our public health officials. They have been really fantastic throughout all of this. And again, a light at the end of the tunnel. I wanted to discuss just a few things before we do a deep dive with some of your questions on COVID. As many of you know, we've been working very hard to serve veterans during the pandemic, and will continue to after the pandemic. But I'm very honored to be the vice chair of the Veterans Affairs Committee. I chair the relevant subcommittee that has jurisdiction over things like housing and homelessness and education and transition. And we passed something called the Thrive Act in the House very recently. And I'm very proud to report that it was just passed in the Senate yesterday. So I think this is going to get to President Biden's desk very quickly. This will be the fifth bipartisan veterans bill that I have helped to lead and introduce in the House that has been signed into law by President either President Trump or now President Biden. So we're really, really excited about that. This bill, the Thrive Act, specifically improves veterans' job training and education benefits by amending a number of the provisions of the bill that we passed and was signed into law in January, H.R. 7105. And based on feedback from the VA, based on feedback from VSOs to make even further improvements. One of the great things about the last couple months is that we have a new $386 million rapid retraining program for veterans who are out of work, but don't otherwise qualify for the GI Bill or any other workforce development program within the VA. They now have access to this rapid retraining program, and the bill that we just passed in the House and Senate, the Thrive Act, makes some changes to what types of high demand occupations will qualify, the job training will qualify, but it's a year-long job training program that will hopefully get, the estimate is 17,000 veterans trained up so they can get into those high impact, high wage, high skilled jobs of the future, just like we have here in San Diego County and in Orange County, things like biotechnology, life sciences, and all the rest. And so I'm really, really excited about that. Also, last week, you may have seen that my colleagues and I founded something called the SALT Caucus, not talking about table salt, talking about the state and local tax deduction. And if you've been following this, you know in 2017, when the last president had the tax bill, the tax cuts bill in 2017 capped the amount that we can deduct in terms of our state and local taxes. And historically, we've been able to deduct all of our state and local tax bill from our federal tax bill. And that has been a huge deal for hardworking Californians who pay quite a bit in things like property taxes. As you know, if you live here and you are fortunate enough to own a home, the average home, 700,000, 800,000, that's average. A lot of them are obviously more expensive than that. And the typical property taxes might be 1% or 1.5%. There's your $10,000 right there. So in our district, there were, before the 2017 tax bill, about 60,000 filers who made less than $100,000 a year, who took advantage of that state and local tax deduction. And I think the misconception out there is that the SALT deduction is only for the very, very wealthy. In a district like ours, in a state like ours, it's simply not true. So we started the SALT Caucus to try to eliminate those caps for the state and local tax deduction, which have been really punitive to the hardworking people in California. I was at one of our local hospitals, and one of the nurses at the hospital came up and she said, "Congressman, I have something I want to ask you about." I thought it would definitely be related to the pandemic. She said, "What are you going to do about the SALT deduction?" And so I said, hey, we're going to do everything we can. But it was illustrative to me that this isn't just about the very, very wealthy. This is about our nurses. This is about our firefighters, our doctors, our teachers, and other average, everyday people who are just trying to get by in California, which is not the cheapest place to live. So we need to fully restore the state and local tax deduction, and we're committed to doing that as part of the American Jobs Plan. Now, this American Jobs Plan is what we're working on right now. We expect the president will be speaking much more about it tomorrow night during his address to the joint session of Congress. At least some members of Congress will be there. Virtually all of us are back in our districts. I'm in California right now. Because of COVID-19 and the protocols in the Capitol, only a handful of members will actually be physically present. But nonetheless, we expect the president to talk about the American Rescue Plan. That was the big COVID relief bill. And the American Jobs Plan, that's the big infrastructure and climate bill, and the American Families Plan, which will be covering things like paid leave and community college and so much else. So I'm very, very excited. Sort of those three legs of the stool for the Biden administration, with rescue, with jobs, and with families. So more to come, and I'm excited about that. I also have another bill that I wanted to highlight, which is a bill to save agricultural fairs across the United States. Many of you know the Del Mar Fair has really taken a hit with the pandemic. They had to let go about 100 people. They had multi-million-dollar losses just because so much of their revenue comes from the fair itself. And as a result, all across the country, fairs are really impacted. So we have the Agricultural Fairs Rescue Act. It is a bipartisan bill, would create a $500 million fund for agricultural affairs across the United States that would be distributed to the states and to the departments of agriculture in the states for the fairs that need the help the most. I don't think it would completely cover the losses of Del Mar and many other fairs, but I think it would go a long way to help. And I'm hopeful that we can move that legislation, get it over to the Senate, get it to the president, because that would be a huge deal for all the hardworking people at the Del Mar Fairgrounds. The last thing I want to do is inform everybody that if they are waiting for their benefits from the American Rescue Plan, and specifically if you're a veteran and you're waiting for that $1,400 or that $2,800, you should now be receiving your electronic payments. The latest round of payments applies specifically to veterans and their beneficiaries who receive compensation and pension or CNP benefit payments and who don't normally file a tax return. Most payments will be automatically deposited in the bank accounts or loaded onto the direct express cards where veterans receive their benefits. Those waiting on paper checks or debit cards through the mail should expect to receive their payments over the next several days. And I will say what I say all the time: if you need any help with any of this, if you need help with a federal agency, you need help with the resources from the American Rescue Plan, the $1,400 direct payments, or anything else, if you're a restaurant owner and you're interested in the new Restaurant Revitalization Fund, which will start up at the beginning of May, if you're a small business owner, you need help with the Paycheck Protection Program. If you're a veteran, you need help with anything at all, veterans benefits, or if you need help with Social Security benefits, or you name it, please, please, please contact our office for assistance. We would be delighted to help you. And while we can't always guarantee a favorable outcome every time, we will do our absolute best to resolve whatever problem you have, or at least find the information that you need and direct you accordingly. So to open a case with our office and start receiving assistance, you can visit us at mikelevin.house.gov. So with that, a lot going on, but I want to get to our dear friend, Richard Garfin, who again has been with us since the beginning of this pandemic. It's ups, it's downs. It's been quite a wild ride, but I would love to hear, Dr. Garfin, your thoughts on where we are now. And hopefully you agree that there is a great light here at the end of the tunnel.
Yeah, I'm enthusiastic as well, Mike. I think that we've made a lot of progress in the last year. It's been really, as an epidemiologist, it's been a mixed blessing. On the one hand, it's been a horrible thing to have to live through, but on the other hand, it's been an amazing experience to see how public health stepped up and was able to handle the situation. So, one of the topics that many people have been asking me about lately is the issue of the SARS-CoV-2 variants. And can these variants undo the progress that we've made so far in ending the pandemic? So I just thought I'd just quickly mention what these variants are and what it means, because I think it's confusing to a lot of people. The variants are strains of the virus that differ due to changes in the virus's genetic code. When a virus infects a cell of a human or an animal, it makes huge numbers of copies of itself, and then they get released and they seek other cells to infect, and then the process goes on again and again. And each time this happens, mistakes can happen in copying the genetic material that goes into the new virion, and we call these mutations. Most of the time, these mutations don't have any effect at all. It's just a minor tweak to the viral gene. It's actually an RNA virus, not a DNA, but you can think of it the same way. And these things happen all the time, and we just expect it. We know it happens. It happens in all organisms that replicate. However, sometimes these mutations can increase or decrease the virus's ability to do things like attaching to a cell and infecting it, or making copies of itself. We call that replicating. Or it can affect how many copies it can make of itself, how efficiently it does that. It can also affect the virus's ability to evade the immune system and cause more severe disease. So for that reason, it's important that we monitor these circulating viruses and we look for key mutations, the kind of mutations that actually are important and they can affect the ability of the virus to infect people or to cause serious disease. And so the CDC and other institutions around the world are sequencing genomes from patients with COVID-19, and they look for these mutations, and then they share that information with each other. And the idea here is that we want to know if there's a mutation coming around that's important that we all need to be aware of. And so one such variant is referred to as the B117, or it was originally called the UK variant. And it was first identified here in the US around December. And in just the last few months, it's already spread to all 50 states in the US, plus Puerto Rico and a couple of our other territories, which is an indication of how quickly these things can spread. It doesn't just stay in whatever state it first showed up in. And what's important about this variant is that it's been found to be about 50% easier to transmit because it produces more copies of itself. And it's also about 40% more virulent, meaning that it's more likely to cause severe disease than the original Wuhan strain that we started out with when the pandemic started. When these variants are found that appear to be more serious or cause more serious disease or infect people who may have already been vaccinated or recovered from having natural infection, the CDC refers to these as variants of concern. And currently there's about 5 variants of concern, although the list is inevitably going to grow, that the CDC is watching. And the thing about knowing about these variants is that these could then become the targets for new vaccines or booster vaccines. And so it's important for us to be aware of them. So the key message here is that we've spent $9 billion to create a vaccine in record time. I mean, this is really historic what we did, and it's fantastic. And not only that, the vaccines are really damn good. You know, these are not, lousy vaccines. They're great vaccines. And so we have this opportunity to end the pandemic. However, every time a person gets infected, it creates a new opportunity for a mutation to happen that just happens to be one of those buggers that is going to be a bad one. And so we want to try to prevent as many infections as we can. So even though we've got a really good vaccine, and even though we're making progress and the numbers are starting to come down, I think it's beholden on all of us to try to not be one of those people that gets infected and creates new variants. And so that means, especially for young people who feel like they're, invulnerable and they're not going to get really sick. So why does it matter? I think we need to prevent infections in those people. And so, continuing with risk mitigation measures like mask wearing, physical distancing, hand hygiene, having good ventilation, getting vaccinated. I absolutely encourage everybody to get vaccinated. And then cooperating with county health officials when it comes to doing contact tracing so that we make sure that anybody who is infected is isolated and those people that they're in close contact with are quarantined until we know that they're not infected. And if we keep doing this and we stay on target, we're going to get through this.
Fantastic. Well, I wanted to ask you, I guess from a public health perspective, what are some of the most important lessons that you think that we as lawmakers should take from this and that the general public need to learn about the way that we've either managed or mismanaged this pandemic?
Yeah, that's such a good question. I think we're going to be teaching about that for a long time in our public health courses. First of all, the public prefers to hear the truth. I mean, I know it's really tempting to try to sugarcoat things or spin a message to avoid scaring people. But I think what we've learned here is that people want the truth. They want the information and they want to be able to make informed decisions with it. So when public health officials and lawmakers don't trust the public to handle these hard facts, they inevitably give mixed messages and ultimately undermine public trust. So that's the first thing. Second, I think we should have relied on our public health systems that were already in place rather than using political appointees or to tout messages that politicians want the public to hear. We have an amazing public health system in the United States with the CDC and the state and local health departments. It has been under a lot of pressure for a while now because of low resources and because of lack of trust in these institutions, but they're really amazing and they're staffed by really, really smart people who spend their time thinking about this kind of stuff. Like they, practice it, rehearse it, they prepare for it, they monitor disease outbreaks so that we know when things are happening. They communicate with scientists and health officials around the world so we know what's coming our way. They're really the experts and we should rely on them. And if anything, we should be bolstering these institutions like the CDC and the NIH and the FDA and the USDA. These are our front line. This is what they were put in place for this exact reason. We should use them. Also, I'd just like to say that this global situation should have been handled in concert with our international partners, such as the EU, the WHO, and others, because we've successfully done this before. We've done this with the first SARS virus. We've done it with Ebola. When these organizations work together, share information, don't call each other names and be distrustful, we can all work together to overcome, a common enemy, which is a pathogen. It has no political ambition. It just wants to survive and spread, and we want to stop it.
Well, I think a lot of people, thank you for that answer. I think a lot of people want to know something pretty simple, which is when can we get back to normal? Today was a big step, hearing the CDC recommendation that people can take their mask off outside if they've been fully vaccinated and are not in a crowd. But I'm sure the inevitable next question is, okay, well, when can I keep my mask off if I'm in a big crowd, or if I go to a ball game, or I go to a farmer's market or something like that? And then, of course, once that happens, they'll say, well, when can I do it when I'm in a movie theater, or if I'm in the halls of Congress, for example? So I guess, how do you see all this playing out as we get more and more people vaccinated and all aspire to get back to normal?
Mm-hmm. Yeah, well, I don't know when or even if we'll ever go back to normal, but there may be some promising signs that normality is returning, such as, to what the CDC's announcement today, that if you've been fully vaccinated, you could get together with other people in small gatherings outdoors. If there are people who are unvaccinated present, then masking should also take place. And if you're going to large gatherings, then people should still continue to wear masks, even if they've been vaccinated. Teachers are eligible for vaccine now, which is fantastic. So our teachers are being vaccinated, and many college and high schools are starting to require vaccinations to attend class in person. And so if the community transmission rates continue to stay low like they are right now, I expect that we're going to see that most schools are going to be resuming in-person learning in the fall. I know UCSD is making plans for it and is doing everything that we can to make sure that we can do so safely. And I think the other universities in San Diego and Orange County are thinking the same way. So I think we're on the right path there. We want to get people back in school. It's also important that we make sure that all members of society have access to the vaccine. There's been some disparities in terms of Black and Latino populations not getting the vaccine. At first, it was sort of thought, well, maybe there's distrust of the vaccine. There might be some vaccine hesitancy in these populations. But as it turns out, that might be part of it. But the big part of it is just getting access. So making the vaccine more available to all populations in our community will also help us to get back on track faster. And I expect that, one day a president or a government agency is going to make an announcement that the pandemic is over. But I think this is going to be largely symbolic, because it's not likely going to be one day where we just say, hey, it ended. It's going to be sort of a slow progression where we just sort of try more and more times where we take the mask off and say, hey, I didn't get infected today. Or we go to a movie theater where we know they've got good ventilation and most people are vaccinated and nobody gets sick. And it'll just sort of normality will come back to us slowly. But I think it's going to take just being patient and, sticking with the precautions as long as we can until we really have the confidence that we've got a handle on the disease.
Thank you so much. We've got several questions related to COVID from our constituents, and I'll get to a handful of them. I'll start with Becky in San Clemente, who asked, since public school teachers have had the opportunity to be vaccinated, is it necessary for elementary age children to continue wearing masks?
Yeah, Becky, the answer to that question is yes. Kids can still get infected and they can transmit to each other as well as their family members and the community. So although the kids might not be getting sick and they may or may not be transmitting to a teacher, they can generate new variants, like I talked about before, and offset the progress that we made. Also, the vaccine is not 100% effective. It's amazingly effective at being 90 to 95% effective However, that means that about 5 to 10% are not going to be protected by the vaccine. And if we have some new variants coming along, maybe the vaccine will be a little less effective. So I think it's important that we continue with masking until we really get the rates of infection down. And hopefully there'll be a vaccine for elementary school age children coming down the pipe. I know that there's clinical trials that have already started that have included children as young as 2. And if that vaccine works and is shown to be effective, we can get those kids vaccinated too. And then I think we can feel really safe about taking the masks off.
Great answer. Barbara in Oceanside has our next question. She asks, I've heard Dr. Fauci say that we can reach herd immunity through a combination of vaccinations and people having had COVID. However, my understanding is that we won't know how long immunity lasts in each person. And I hear people using this as an excuse to not get the vaccine, not wear a mask, etc. What do we actually know and not know about natural immunity? It's a great question, Barbara.
Yeah, I agree. So it's hard to know what proportion of the population has to be immune in order to get to that herd immunity. Some have said it's about 75%. We know that for the measles, it has to be 90%. So 90% of the population has to be vaccinated or immune in order to get to that herd immunity. And since this is a new disease, we can make some estimates based on the experience that we have with similar viruses, but those estimates sometimes need to be adjusted based on what we're learning or what we're observing with the pandemic. We have seen some reactions, but they're not reinfections, but they're not that common. And it's unclear whether this is due to waning immunity or infection with a new variant. And the good thing is that we're starting to do a lot more genomic sequencing of the variants, so we can tell if somebody who was already immune and gets infected, is it because it's that their immunity has worn off, or is it just that it's a new variant that they're not protected against? And these new variants that are coming in, they're always going to be a threat, so we have to monitor that carefully. When these breakthrough infections occur, though, scientists try to determine whether the variants were the cause of the infection or whether there was actually waning immunity. And it looks so far like the immune system is pretty stable. We've only been vaccinating people for 3 or 4 months now, so we don't know how long that immunity is going to last. But for people who have been infected before and have antibodies, they seem to have pretty stable immunity. So I think the biggest thing we're worried about right now is variants, but in the meantime, doctors and scientists are going to continue to monitor people to see if we get more of these breakthrough infections. That would be an indication that protection is waning.
And just so I understand, you said, I know Fauci said between 70 and 85% for herd immunity, but you said maybe even as high as 90? That's what it is for measles, or what are you thinking is that?
Yeah, I would probably go with the lower estimate. Measles is very, very infectious, more so than the coronavirus. So I think we probably don't need to get quite as high as 90%, but I just use that as an example that, for some viruses, you have to have very, very high levels just to be able to get that herd immunity. And so, when we look at how many people are being vaccinated, we are doing a pretty good job. Some states have hit almost 50% vaccination rates. Then you throw on top of that the people who've had natural infection, we get a little bit higher. But there's a problem with some people that are reluctant to get the vaccine. And some of it might be because they don't have access to it. Some might be because they don't believe in it. Some might just be saying, well, I think I'll wait a little while and see what happens. Maybe I don't really need to get the vaccine. And my recommendation is just the sooner everybody gets vaccinated, the faster we're going to be able to reach some level of protection for the whole community.
Certainly agree with that. Another question related to the vaccine from Alexander in Carlsbad. I've actually had this question myself, so I'm glad that Alexander asked it. When will I find out if the 2 Pfizer vaccinations I received will require a booster?
I think we're all waiting for that. Most vaccines do a pretty good job of giving long-term protection. The measles vaccine, you get it once in your life. The tetanus vaccine, you get it every 10 years. The flu vaccine, you get it every year. But the thing about the flu vaccine is it's not that the immunity wears off, it's that every year we get a new strain that circulates around the globe from where there was a genetic shift in the virus, and now we're actually fighting a different flu virus. So I think what may happen here is that we might start to see some breakthrough infections among people that have had both doses of the Pfizer or the Moderna, or even a single dose of the Johnson & Johnson vaccine. And the question is going to be, is this a new variant? And we'll know that because the CDC is monitoring to see if new variants are emerging, and that they might be the ones that are going to break through the vaccine protection. Or if they're happening with a common strain and it's among people who have been vaccinated, then it's going to be an indication that maybe their immunity is starting to wane and a booster might be needed. So we don't know, and I'm sorry I don't have the answer to that. It's still so early. Normally we talk about vaccines and you worry about it a few years later. Now we've only had this, disease for a year and a half, and it's hard to know what the long-term outcomes are going to be just yet. So far, so good, though.
We'll be having you on again, and we'll be asking again about the need for.
I'll be a little grayer by the time we have the answer, probably.
you and me both. You and me both. Stephen in Vista, he has a pretty simple question. I suspect I know what your answer is going to be, but we'll ask anyway. Which vaccine is the best and why?
First of all, I'm not being paid by any of the pharmaceutical companies that are producing these vaccines. The Pfizer and the Moderna are both the messenger RNA viruses or vaccines, and they have roughly the same effectiveness after 2 doses, which is around 94-95%, which again is fantastic. These two vaccines require, both doses, and full protection is conferred about 2 weeks after the second dose. The Johnson & Johnson vaccine is an adenovirus vaccine. It's a different technology, just as safe and very, very effective, but it's been shown to be about 67% effective at preventing moderate illness and 85% effective at preventing severe illness. So not quite as high as the Moderna and Pfizer, but still, very, very good vaccine. The main difference between these right now in terms of getting them out to the community, to the public, is that the Moderna and the Pfizer vaccines have to be kept frozen, and they can only be diluted right before they're used. Now, the good news is that the FDA has determined that you can keep these vaccines in a normal freezer as opposed to at minus 80 degrees centigrade. So that makes them a little easier to handle, but it makes it kind of hard to get them out to a lot of different, small doctors' offices because they don't have the equipment to necessarily keep them. Whereas the Johnson & Johnson vaccine can be kept in a refrigerator for up to 3 months. So that's the vaccine. You can put it on a mobile van and take it out to communities. You can have it in, mom and pop clinics, and so it might become more available. The truth of the matter is all 3 of them are excellent. I would take the first one you could get your hands on.
And any of the others, AstraZeneca, Novavax, any of the others worth commenting on?
Since right now they're not available in the United States, I don't think I'd want to spend a lot of time on them.
I think we just sent, or we're going to be sending 60 million doses of AstraZeneca around the world, and hopefully that will really help in parts of the world. And yeah, I've heard time and again from some in the international public health community that we really can't end the COVID global pandemic until we deal with it globally, until we as long as we have a spike in cases and hospitalizations and deaths anywhere, we're all at risk. Mm-hmm. So hopefully that will help.
Yeah, absolutely. Sorry, Mike, not to interrupt you on that thought, but it's a really important point there. We were talking earlier about travel, international travel.
Yep.
And the thing is, if you travel anywhere, if you go overseas for a business meeting or vacation or a wedding, and you get exposed to one of the variants over in that other country and you come back here, it just continues to perpetuate this problem. So we need to stop COVID everywhere if we're going to stop it anywhere.
Well said. Next question is from Jess in San Diego. What do you think is the most important reason to be vaccinated besides herd immunity?
Great question. I have two reasons. First, I don't want to get sick. Uh, from what I hear, COVID is, as bad or worse than the flu, and I've had the flu, and I certainly don't want to get that. Even if it's not serious enough to be hospitalized, I don't want to take a week off of work, if I'm going to take a week off, I want to be on vacation. I don't want to be at home in bed. So to me, getting the vaccine just avoids that whole problem. And then second was this issue I talked about with the variants. Even if I don't get sick at all, but I'm infected and I'm producing new virus, I could be the source of one of these variants that might end up being more infectious or more lethal, and create a bigger problem and set us back from all the progress we've made so far.
Good answer. Good answer. Linda in Encinitas asks, can an unvaccinated person spread COVID-19 to a fully vaccinated person?
Yeah, that is a really good question, and it's one that scientists are trying to answer right now. Since the US hasn't approved what are called challenge studies, these are studies where healthy vaccinated volunteers are experimentally exposed to the virus to see whether or not they actually can become infected. There are some trials that are just starting in the UK where they're actually doing this. And challenge trials are not unheard of. They've been used before for things like cholera vaccines and other vaccines. But we haven't approved any in the United States. And so because of that, it's really hard to know, when people are actually being infected. So with the trials that were conducted on the three vaccines that we have so far, the J&J, the Pfizer, and the Moderna, they all measured serious illness or death as the outcome. So they weren't actually looking at infection. They just wanted to see if it would reduce the seriousness of the outcomes. And that's the measure that everybody's looking at, that 90%, 95% is the reduction in serious illness among people who have been infected. But those trials were not designed to measure whether or not people are being infected. So unfortunately, we didn't get a lot of information about whether or not people who are vaccinated were still able to be infected. And that's why there's still a recommendation to wear masks from the CDC, even among people who are vaccinated. However, since then, we've had this opportunity to look at, millions of people in the United States who have already been vaccinated and then sort of observe whether or not they're becoming infected. And it looks like the infection rate is really, really low. There might be a few people who have these breakthrough infections, but the proportion of people who've been vaccinated who get infected is really very low. So that's the good news. However, if you are a vaccinated person and you are with somebody who is unvaccinated and is at a high risk for being infected, or potentially they are infected, it's still a good idea to wear a mask, because you might be one of those people that where the vaccine didn't take, or your immune system didn't respond correctly to the vaccine, or that person might be infected with the variant that you're not protected against.
Well, thank you so much. Those are all fantastic answers, and what a incredible success record we've had with these vaccines now. As you said, I'm just so proud that we've got 200 plus million shots in arms in less than 100 days. The president's giving his 100-day speech tomorrow night, and here we are with over 200 million doses administered. I think it's important to just congratulate the administration, the whole team, Jeff Zients and Andy Slavitt and the whole team that has just worked extraordinarily hard. Dr. Walensky at the CDC, and of course everybody at the NIH. And I also think it's important just to set the record straight. If you go back to last March, in fact, I'm looking at an article from the New York Times, March the 4th, 2020, House passes $8.3 billion emergency coronavirus response bill. This was for the vaccines back then. This is the very beginning. This is before we declared a national emergency. This is before many of the things that we now know about COVID were even known. But we passed $8.3 billion for the vaccine, and then the subheading is the spending package dwarfs what the Trump administration requested to confront the outbreak. So I will just leave it there. House Democrats, $8.3 billion. And I think the Trump administration wanted $1.25 billion in new money. And then they wanted to take other money from things like Ebola, et cetera. But I'm very proud of the fact that we funded it from the beginning. Now, credit where credit's due with regard to Operation Warp Speed and Moncef Slaoui and a lot of the other correct decisions that were made along the way. And great credit goes to the private sector as well. Pfizer and BioNTech were able to do this without the government support that Moderna received and that others received. So a huge success for technology, for messenger RNA, for biotech, life sciences, the NIH, all involved. And now here we are again at the last leg of this race. And I hope that one of the lessons that we learn is let's keep investing in science, because that's why we're here. And it wasn't an overnight investment that led to these vaccines being so successful. It was a couple, 3-4 decades of investment that created the circumstances and allowed both the public and the private sector to come together with these great solutions. So let's keep investing in science, I guess, if there's one takeaway for me. Here's a few questions unrelated to COVID-19. Tony in Capistrano Beach asks, is there any hope of bringing federal, state, and local officials together to discuss our eroding coastline before it's too late? Well, Tony, that's exactly what I have been trying to do. It's what I'll keep trying to do, working with our stakeholders at every level in both San Diego County and in Orange County. And in fact, you may remember my guest to the last State of the Union was Dr. Pat Davis, who tragically lost 3 of his family members in Encinitas during a bluff collapse in 2019. It was just an awful circumstance. And I think that the federal government has a responsibility to help prevent accidents like that from occurring in the future. And we're going to do everything we can to make that a reality. And we are working with the U.S. Army Corps of Engineers to contribute tens of millions of dollars in federal funds for the Encinitas Solana Beach Coastal Storm Damage Reduction Project, which was created to stabilize tall bluffs, as well as a shoreline protection project in San Clemente. We've gotten all the planning, engineering, and design work done on that. And we'll be asking the Army Corps to fund the construction right away. And those projects will help to replenish vulnerable areas of the beach with additional sand to combat erosion. And the other thing I'll mention is the $1.5 million that we got to finalize the PED, planning, engineering, and design for Encinitas and Solana Beach. So it's a 2-step process. You have to finalize your planning, engineering, and design. Then you have to get what's called a new start before you can commence construction. So we've got a great team in DC. We are working hard on these projects. We're going to do everything we can to bring them to fruition to protect our coast. And then, of course, we're also working on it in Del Mar with the Del Mar Bluffs and all the erosion there along the low sand rail corridor, doing everything we can to prioritize that project and engage with Sandag and the other stakeholders as well on that. So the good part about our beautiful district, 52 miles of incredible coastline, amazing beaches, great recreation, but it's obviously like everywhere else, it is subject to erosion, subject to bluff collapse and the damaging impacts of climate change that will continue to get worse over time. So we've got to be prepared. We've got to be ready. We've got to engage all resources available at the federal, state, and local level and work together and get things done to rectify the situation or at least mitigate it as best we can. Thanks as always for your concern and your advocacy on it, Tony. Appreciate it. Marianne in Carlsbad asks, how will you move forward with real policing reform to prevent what happened to George Floyd? Thank you, Marianne. First, let me say that I am very relieved that Derek Chauvin will be held responsible for his actions. It doesn't change the fact that George Floyd should still be alive today. But I think now where we go, and Karen Bass, as many of you know, is a dear friend that we've had on our podcasts and our virtual town halls in the past. She's working very hard with Tim Scott, Senator Tim Scott in the Senate, along with Cory Booker in the Senate on a bipartisan compromise. We passed the George Floyd Justice and Policing Act in the House in the last Congress. We reintroduced it and passed it again in this Congress. We are proud of that bill. We're having a constructive dialogue with the Senate to try to come up with some sort of compromise. And I'm actually more optimistic about this than I have been since George Floyd was tragically murdered last year. You know, even some of the law enforcement organizations, particularly those that we have in California, they're more open-minded to a comprehensive bill than at any time previously. And I think looking at that kind of the outline of the Justice and Policing Act is a good place for us to begin. Establishing a national standard for police departments, mandating data collection on police encounters, reprogramming funds to invest in community-based policing, streamlining federal law to prosecute excessive force and establish independent prosecutors for police investigations. Those are all things that I think we can achieve. And stay tuned, because I think it's going to happen. Michael in Oceanside, great question. He says, I don't see any talk about compromising on the SALT tax deduction, only keeping it or eliminating it. What about a $20,000 or a $30,000 limit? That would still help a lot of people making less than $400,000 a year, which was Biden's target audience, without looking like a big giveaway to billionaires that even a lot of Democrats don't want to support. Michael, I completely agree. I think you raise an extremely good point. I may have been speaking with my colleagues behind the scenes about this, about exactly what we might be able to achieve. I totally get it. There are some states where if their state and local tax burden is much lower, they're a lot less likely to want to support this. And I also understand those that are concerned, saying that this will only help the wealthy. I can tell you, I've looked at the numbers, and it's simply not the case. It won't just help the wealthy, particularly in California, New York, New Jersey. But let's have that negotiation, and let's have a real dialogue about it. And if we are able to increase the cap from 10 to 20 or from 10 to 30, that'll be a huge help. And you're right, the people at the very top who deduct 40, 50, 60, 100,000, making millions of dollars a year, or paying huge amounts on gazillion-dollar homes, you're right about that. But when I look at the numbers and I see people who are making $80, $90, $100,000 a year who are deducting $10,000, $15,000 a year because of high property taxes or other high state tax burdens or local tax burdens, then I think that it's important that we do all we can to help them. So you're right. If we were to increase it to $20,000 or $30,000, that would go a long way. I was proud to lead a letter of the California delegation. All 41 other Democrats. The speaker did not sign, because the speaker never signs any letters, but we got every single California Democrat. I tell you, it is a big delegation. Having to round everybody up was not easy, but we did it. We got them all to sign. We sent it to the president. We said, Mr. President, we support the American Jobs Plan. We support your vision for the country. Work with us to fix this issue for hardworking California families. And so I'm hopeful that's what he's going to do. So with that, my goodness, great questions as always. And Dr. Garfin, it is fantastic to see you. And I'm hopeful by the time we see you again, that it will be in person. Wouldn't that be amazing? I think it would be fantastic. But I wanted to make sure to give you an opportunity for some closing remarks.
Well, thanks, Mike. It's a pleasure to be back with you again, and I'm glad that the circumstances have improved. We're definitely making great progress here with the pandemic, and we could all go back to working on other important issues. I'd like to say we've made great progress. I think the vaccine is a new tool in our toolbox, but it doesn't mean that we throw out all the other tools. We still know that the best way to prevent transmission of coronavirus, as well as other things, the flu virus, tuberculosis, the common cold, is by not sharing air with other people. And, we could do that by wearing masks, by being outdoors, by having good ventilation in the buildings when we are in them, lots of, exchanges of fresh air. And we should really be putting all of our energies into doing all of these things, not just one or two. And if we do so, we can really beat this pandemic. And we have to think about our friends and neighbors outside of the United States, because they're suffering with this right now as well. India is having a terrible problem. They're having more cases per day than we've ever had in the United States, even though we have already had 38 million cases in the United States. We need to think about what we could do to help others, because we like to travel too, and we want to be able to go to those other countries. And so we want to make sure that they're safe places to visit and those people are safe to come here and visit. So I just say, stick with it. We can do this. We can do it together. We've got great public health people, doctors, physicians, scientists, House representatives that are all working very hard to try to help us to get through this situation. And I know we can do it.
Well, I'm just honored to follow the lead of the great scientists and doctors and public health professionals in the community like you. And I just thank you for your ongoing leadership. I really want to thank our team as well for doing all of these wonderful events, and particularly my comms director. It's late right now in Washington, D.C. If he's still up, thank you for all his good work. Eric, me in D.C., and our chief, Kara, as well. It is getting late over on the East Coast, so we thank them. I thank my in-laws and my parents who usually check us out on these. And if my in-laws are listening, hold off on that trip to Africa for now. But we'll be able to do it soon, I promise. But as always, I wanted to end on some good news. Last week, I announced my April constituents of the month, Donna Callas of San Clemente and Giselle Anderson of San Juan Capistrano, for their efforts with the World Cetacean Alliance and making our district historic by establishing Dana Point as the first whale heritage site in the United States. That is pretty cool. And I can tell you, as a native Southern Californian, I know firsthand how incredibly special our coastline and marine life are to the community. I am grateful to Donna and Giselle for leading the charge and letting the world know just how fortunate we are to have these incredible creatures right here in our backyards. And as leaders in the community, I thank them both for their advocacy and their trailblazing efforts of bringing global attention to the most amazing population of dolphins and whales like nowhere else in the world. And that is really true. And for those in our district that have not been down to Dana Point Harbor for some whale watching, I hope you do it. I am honored to recognize both as my April constituents of the month. That's all for now. Thanks so much for joining us. We'll see you next time.